There's still time to squeeze in a summer getaway, but is that the safe thing to do right now? The CDC is not telling people to cancel summer trips just yet, but there are certain types of travel that can be more dangerous for coronavirus infections. Haley Hernandez has the details.
The CDC's updated practical advice for using public transportation, ride shares, and air travel was consistent with other advice on preventing infection. Wash your hands and be careful what you touch. To improve air circulation, open windows, especially in cars. Infectious disease Dr. Linda Yancey from Memorial Hermann and Katy says air travel has more risks, but spacing rows between your family and others could help.
The way air circulation on airplane works is you are sharing air with the people to either side of you and the people on the other side of the aisle with you, and a couple of rows backwards and forwards. The air circulation goes around, not up and down the plane. So I know a lot of airlines are trying to distance people in alternate rows. That's actually a really good way of isolating people in pockets of airflow.
When traveling by air, bus, car, or train, limit touching these surfaces. Kiosks, touch screens, and fingerprint scanners, ticket machines, turnstiles, handrails, restroom surfaces, elevator buttons, and benches as much as possible. If you have to, wash your hands or use sanitizer after you touch them. Dr. Yancey says there's also increasing proof that masks will keep you safer.
Wear a mask or a face covering. That is very important for protecting the people around you. Cloth face coverings work just fine. Just make sure you've got at least 2 layers of cloth.
And consider traveling during non-peak hours when there are likely fewer people.
Experts say to look for social distancing instructions like floor decals or signs showing you where to stand or sit while traveling. Dr. Yancey says this will be the norm for several months. If you have a teen at home, you may want to buy some blackout curtains for them. A new study suggests light pollution affects their sleep, which can impact their mental health. Researchers looked at mental health and sleeping data from more than 10,000 teens and found those who lived in areas with high levels of outdoor artificial light at night slept less during the week. That made them more likely to have a mood or anxiety disorder compared to teens who lived in areas with low levels of light pollution.